Hello, here I am Dr. Pramveer Kumar from Bokaro. Today I will discuss about update of hypertension. WHO nearly 63% of total deaths in India are due to non-communicable diseases. 24% are attributed to cardiovascular disease only, which affects 45% people in the age group of 40 to 69. Raised blood pressure is among the most important risk factors for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about the hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, 51% of the men and 41% of women with hypertension were unaware of the condition. Additionally, over 62% of men and more than 53% of women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the inclusion of optimal and essential treatment paradigm attempts to address the issue that in resources poor setting. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow a specification of essential standards of care for low resources settings. The AHA has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low CVD risk. Among low risk adults, no CVD या 10 years CVD risk less than 10% with a stage 1 hypertension. Blood pressure 130 to 139, diastolic 80 to 89 mmHg. Management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study which appears in the Journal of the American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 mmHg range substantially reduce cardiovascular adverse events in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients aged 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk, finding from now a second major trial supporting a lower target could unite the guidelines, which even among US professional society range from threshold of 130 to 150 mmHg. With regard to prognostic value of ambulatory blood pressure, monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also on out-of-office measurements such as ABPM या home blood pressure monitoring. 24-hour and nighttime blood pressure measurements were associated with greater risk of mortality, and composite of cardiovascular outcome. Thus, they may be considered as the most relevant measurement for estimating cardiovascular risk. For every 20 to 10 mm of Hg increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence of therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure targets, to start antihypertensive therapy with an initial dual fixed dose combination of AC inhibitor या ARB plus CCB, that is calcium channel blocker or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, which can be found in candidate-sartan, irbesartan, losartan, olmesartan, valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminated valsartan from Jiang, Huai manufacturing site where this is the manufacturing site of where the highest level of contaminated were found. Every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of by 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary cardiovascular outcome. An ambulatory blood pressure measurement was performed for 48 hours to collect data on how BP differ during sleep. RR reduction of cardiovascular events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.